This is RTV6 News at 5:30, working for you.
And now at 5:30, 100 homicides in Indianapolis, and it's only the middle of June. A community leader weighs in on what he calls a lack of urgency in addressing this growing number. And the season cut in half for a downtown business due to the pandemic, but they're open now. How they are working to keep you safe as they work to make up for lost time. Usher.
Here's what we're talking about today in our lineup. Many people losing their jobs are also losing health insurance. We have some possible solutions for those struggling with paying to see a doctor when they need it most. Juneteenth is a state holiday or observance in nearly every state. Today we're hearing from this woman who's been on a mission for years to make it a federal holiday. And a lot of us are uncertain about flying, how airports are now turning to robots to try to make us feel more at ease.
And now at 5:30, overnight Indianapolis reached a mark no one is celebrating. A man was found dead around 1:30 this morning near 35th and Keystone. The man who had been shot is the 100th homicide victim of the year. RTV6's Kelsey Anderson spoke with the president of the Indianapolis 10-Point Coalition, a man actively involved in efforts to reduce violence in our city, about the rising homicide rate.
Reverend Dr. Charles Harrison says, as a city, we are bleeding and we need to take action now instead of waiting for someone else to step up and do something. In the early morning hours Wednesday, 7 people were shot, 2 of them fatally. Community leader Reverend Dr. Charles Harrison took to Twitter saying, Indy is in a public safety crisis. He continued saying, quote, if Black Lives Matter, then why is there not an urgency about alarming number of blacks being killed by homicides in Indy? He says, as a parent, he doesn't feel the city is safe for his 2 teenage children.
We need the mayor and all the elected officials to join in with us community leaders, and we need to address this together. Yeah. Our children should not live in this kind of fear. They shouldn't. Our seniors should live in this kind of fear. None of us should live, in this kind of fear.
Yesterday, 4 people were shot and killed in Indianapolis and another one early this morning, bringing the city's total to 100 homicides this year, a number we didn't see until September of last year. I spoke with Shauna Majors, the city director of community violence reduction, and she says now that COVID-19 restrictions are starting to be lifted, her and her team can safely get back out into the community.
I know the mayor is very concerned, chief of police, myself, we are very concerned. The community is extremely concerned.
They have community outreach events already planned for next Friday. Both Harrison and Major believe the more people that are involved in this fight against violence in the city, the easier the battle will be. For resources on how you can get involved, head over to theindychannel.com. I'm Kelsey Anderson, RTV6.
Thanks, Kelsey. We continue to stack up some beautiful weather days here in the middle of June. We've got a lot of that sunshine out there and the very low humidity, which is providing us a little bit of a bubble from those showers and storms that you can see over portions of Ohio. We've had one little shower that's been sneaking through portions of Greene County, approaching Bloomfield, but that will be very brief and on an isolated basis. Our temperature right now in downtown, we're at 85 degrees. There's that nice humidity at 36% with just a calm wind in place. Temperature 84 in Columbus. It is heating up a little bit, though. Terre Haute close to the 90-degree mark. And as we look back across the central portion of the country, there has been this heat bubble, and part of that will break off heading our way over the next couple of days. We're still waiting on that first 90-degree temperature of the year, but I don't think we're going to have to wait much longer. This evening, temperatures still going to be warm through 9 o'clock. We're in the 80s for you with just that stray shower chance, but we do have rain chances that will be on the rise in the 7-day planning forecast. I'll have more on that in just a few minutes. Usher.
Students and faculty at Loyola University's Stritch School of Medicine are some of those happy to hear today's Supreme Court decision on DACA. It was the first medical school in the country to admit undocumented students. Today's decision allows students to move on to the residency program and eventually make it to the front lines.
DACA gives them a work permit. And so the fear that the Supreme Court today might have struck down DACA and taken those work permits and pulled those physicians off the front line was terrifying. So we're over the top thrilled right now that DACA lives another day.
Mark Kushevsky is a medical ethics professor at Loyola. He says with the pandemic, there's an even bigger need for doctors, and thousands of those doctors rely on DACA.
These are physicians in their emergency rooms, in their ICUs, treating them along with nurses and other frontline healthcare professionals. Around 60,000 people working in healthcare are DACA recipients right now.
Last fall, the Association of American Medical Colleges told the Supreme Court that termination of DACA would be catastrophic. Today's decision isn't the last and final hurdle for recipients. Immigration advocates are still asking for a policy that would create a path to citizenship for dreamers. Well, Atlanta attorneys are clearing up confusion in the Rayshard Brooks fatal shooting case that tops our news feed. The defense attorney for the second police officer charged says he has not agreed to be a witness against the officer who shot Brooks in the back. The second officer is being cooperative in the investigation, but he has not agreed to testify or plead guilty. The University of Mississippi is moving one of its Confederate monuments. The school got final approval today to relocate a soldier statue from a prominent area to a more secluded part of campus. Ole Miss started working on this before the recent protests, and other monuments were torn down or removed. Another well-known brand could be changing over racist origins. The makers of Cream of Wheat say they are reviewing its packaging, which features a smiling black chef. Although the exact origin of the chef's image isn't known, companies are examining everything now that could unintentionally support systemic racism. Ahead in the lineup, this 93-year-old woman has been on a mission for years to make Juneteenth a federal holiday.
I'd probably do a holy dance. I'd be so excited. And I believe it's going to happen.
Her new push now that she's hoping others will join.
Easy, even Petey can do it.
As more of Indiana reopens, that means you'll hear singing once again from the gondolas of the downtown canal. They just opened a week ago due to the pandemic, which is cutting their normal 6-month season in half. Some changes are in place for health and safety. You cannot buy individual seats, just private boat rides for 2 to 8 people. And the gondolier is 11 feet away from the passengers.
One of the things that's really great about our business is that we're with people every single night when they are celebrating those moments in life. And we've all been cooped up at home, and it's time to get out and celebrate those birthdays, anniversaries, weddings, proposals. You know, that's important. Time with family, friends, and loved ones. Come do that with us here.
It's suggested you make a reservation online at 4gondola.com. That's the number 4gondola.com. Rides are 30 or 60 minutes. The gondolas operate daily from 1 to 9 p.m. through September 11th. Usher.
Tomorrow marks Juneteenth. It commemorates the day in 1865 when slaves in Texas learned they were free, 2.5 years after the Emancipation Proclamation was issued. 47 states and Washington, D.C. celebrate it as either a state holiday or observance. This week, the governors of New York and Virginia announced proposals to further recognize Juneteenth, but it's not a federal holiday. A Texas woman has been fighting to make that happen for years. And for Opal Lee, it's personal. On Juneteenth, about 80 years ago, a mob of 500 white supremacists tried to scare her family out of their home in Fort Worth, Texas.
My father came with a gun, and the police told him if he busted a cap that they would let the mob have us. The paper said, the police said the crowd was so large they couldn't control them. But they tore that house apart. They burned furniture.
Lee is now 93 years old, and she's dedicated her life to education and activism. In 2016, she walked from Texas to D.C. to advocate for Juneteenth to become an official national holiday. Even a pandemic won't stop her. This year, she's plans for a socially distanced celebration and a symbolic 2.5-mile walk. Lee says Juneteenth is about unity and recognizing freedom for all.
Slaves weren't free on the 4th of July. So if it happened now, I would be ecstatic.
If you'd like to join Lee's cause, you can add your name to her petition on change.org. She's hoping it will get to 1 million signatures and send a message to Congress to act. Well, so many people losing their jobs are also losing their health insurance.
I was taking a risk by, That's all I need to do is turn my ankle and break my ankle. And all of a sudden, I got a $5,000 hospital bill.
Ahead in the lineup, how you can get help if you're struggling to get health care. Lawmakers are looking at a bill that would address the disproportionate number of minorities affected by coronavirus. The Health Enterprises Zone Act would incentivize doctors to work in minority and low-income communities. Several studies have shown that people of color, especially African Americans, are disproportionately dying from coronavirus. Experts say minorities are more likely to have certain conditions like asthma and heart disease, but lack of quality health care also plays a role. The COVID-19 and cultural crisis in the U.S. are becoming even more intertwined.
The COVID crisis is shining a light on who's being left out by our society and who gets hit hard during a time of crisis. But the issues it's raising up are the issues that make everyday life in America for millions of people a crisis or on the edge of a crisis.
Dr. Richard Besser is head of the Roger Wood Johnson Foundation, a philanthropic group dedicated to improving health care in America. They released a set of health equity principles for local and state governments to make sure all residents recover fully and fairly. Right now, Black Americans are disproportionately getting sick and dying from the coronavirus. Black people make up 13% of the U.S. population, but represent 23% of all COVID-19 deaths. In some states, it's considerably higher. Experts say minorities tend to suffer from poorer health, and that's tied to segregation and discrimination, leading to lower paying jobs, living in poorer neighborhoods, less health insurance, less access to healthy food, and quality doctors.
As we're making recommendations, like isolating at home away from others, that we're ensuring that we're providing recommendations that meet everyone's needs. And countries that have been most successful in curtailing and stemming the severe impact have provided safe places and economic support and nutrition support for people during those periods of isolation.
The foundation's suggestions include gathering more granular data on coronavirus impact, not only on race, but ethnicity, disability, and by neighborhood. Also establish teams dedicated to promoting racial equality in response and recovery, and talking to people in the community about their needs. Every healthcare professional we've talked to says COVID-19 has brought even more attention to the need for equal health care and access to sick leave. Well, one way to combat systemic disparities and improve equality for all could lie in simple employment changes. Boston University researchers found eliminating salary history questions on job applications could benefit minority groups and women the most. Data found that employees in states that installed these bans saw a 5% increase in pay. For women, that jumped to 8% and 13% for Black Americans. More than half of states have some sort of salary history ban now.
Zoo will reopen tomorrow as Marion County enters stage 4 of the reopening plan. Part of the safety plan requires that all guests and members get a timed ticket in advance of your visit by going to IndianapolisZoo.com. And Holiday World in southern Indiana opened to the public just yesterday for the first time since the COVID-19 pandemic. The water park is targeted to open July 4th. A reminder, you need to buy a ticket online to secure your spot for the day. And since it's Thursday, we're offering you a little Holiday World trivia for Throwback Thursday. Holiday World is believed to be the nation's first theme park rather than simply an amusement park. It opened as Santa Claus Land in 1946 because of its location in Santa Claus, Indiana. The park became Holiday World in 1984. We have much more on what the park used to look like at our website, theindychannel.com/history. Kyle, did you know that?
I did not know that, Amanda, but I do know that I'm sure a lot of people are going to be looking for a pool or a place to cool off this weekend, because not only are those temperatures going to be climbing, but we're also going to notice that humidity, especially by Saturday. Still feels pretty good. It is certainly warm out there this evening. We've got 85 in Indianapolis and Bloomington with a light wind out of the east and southeast. Tomorrow morning, we will start off with dry conditions and temperatures in the middle 60s across central Indiana. 65 in Danville and Hendricks County, 64 in the Rushville area, and temperatures are going to start off again in the middle 60s, but they warm quickly. This is a forecast that probably looks pretty familiar over what we've had the last couple of weeks. We'll see that increase in clouds for the afternoon and temperatures approaching 90 degrees. So possibly our first 90 here of 2020 as we get to around 90 in Indianapolis, Bloomington, Lafayette, and Muncie. If we don't get there on Friday, I think we do on Saturday. Forecasting a high of 92. You can see that record of 100 degrees. That's going to be safe. But with all this dry weather, the drought monitor that came out today is actually showing abnormally dry conditions across all of central Indiana. We've kind of missed out on heavy rains to our east and to our west over last week or so. But those rain chances are going to be climbing in that 7-day planning forecast. In fact, as we get into Father's Day, I think especially the afternoon and evening, we get some better rain chances in the forecast, and that will gradually bring down those temperatures a little bit after peaking around 92 on Saturday. We're into the lower 80s next week, and that humidity coming back down by about Wednesday with a high of 82. Usher?
Checking the news feed, kids with COVID-19 will soon be able to take part in a study testing the experimental drug remdesivir. It's already shown positive results in adults to shorten recovery. Taco Bell says employees are allowed to wear Black Lives Matter masks. This after a worker in Ohio says he was fired for refusing to take one off. In a viral video, he says he was told it was too political. Restaurants may be getting more federal aid. A bipartisan group of lawmakers are pushing for $120 billion in a new economic relief package. The food service industry lost almost 6 million jobs in March and April. Forbearance, car and credit card payments, even student loans, the amount of debt people are skipping payments on is racking up. It's totaling some 106 million accounts, not dollars, according to credit agency TransUnion. The largest recent increase is in college debt, followed by car payments and personal loans. The government made it possible to defer mortgages and federal loans through the CARES Act. Many private debt companies followed suit. This isn't supposed to affect your credit score. Well, millions have lost their jobs because of COVID-19, and now as a result, their health insurance. Some experts say the consequence of that could be deadly. Chris Conti looks at some possible solutions to help those who are struggling.
As the most visited national park in the country, tourism is the backbone of Gatlinburg, Tennessee. But COVID-19 has thrust that industry into darkness.
March 23rd was my last day.
Brandon McCarter was once a catering manager in Gatlinburg. With conventions canceled and his job gone, this 64-year-old also lost his health insurance.
There's uncertainty in that, I'm not sure what I'm going to be doing a year from now or even 6 months from now.
Not having health care means any trip to the doctor comes out of Brandon's pocket. Even everyday activities like hiking with his wife come with a new level of concern.
I was taking a risk by, that's all I need to do is turn my ankle and break my ankle. And all of a sudden, I got a $5,000 hospital bill.
Brandon is not alone. Roughly half of the country's population relies on their job for health care. But nearly 27 million people have now lost employer-sponsored health insurance because they're out of work.
We have massive numbers of people who are worried about their health but don't have health insurance.
Michelle Johnson is a health policy advocate. She says the consequences of Americans losing their health coverage could prove deadly as more people avoid going to the hospital when they're sick for fear of ending up with bills they can't pay.
When there's a pandemic, it's also important for all of us. We don't want folks to not access the care they need to get healthy and stop the spread of the virus.
So what might help those without a safety net right now? Johnson is lobbying for Congress to expand open enrollment under the Affordable Care Act. She also says states need to strongly consider expanding Medicaid coverage. That would mean Americans stuck in the health care gap right now could get coverage. For those afraid to see a doctor, her advice is to call ahead before you visit and see if you can work out a payment option before a bill arrives.
We know that if people don't have health insurance, they're afraid to go get health care.
As for Brandon McCarter, he's actively looking for a new job.
First purchases would be health insurance. If I got a job offer, my first question would be, does that include health insurance?
Even in a place as beautiful as this, it's nearly impossible to escape the pressures of this pandemic. I'm Chris Conti reporting.
Next in the lineup, a lot of us are still feeling uncertain about flying. How airports are now turning to robots to try to make us feel more at ease.